All right, well, welcome back to Health Made Easy. I'm your host, Dr. Jason Jones, and I'm super excited for our guest today. We have Dr. Judson Brandeis, or is it Brandeis?
Brandeis.
Brandeis, gotcha. And we have a really cool topic that we haven't spent a lot of time on before, and because oftentimes in health, it's all about women's health, and and women certainly have their challenges, but oftentimes we don't think about or focus on men's health. And we're going to be talking about today how to continue looking good through midlife and beyond. Dr. Justin, thank you so much for being here. Super excited to have you. I know that some of our listeners may not really have heard of you before or not familiar with your work. Can you tell us just a little bit about yourself, kind of give us a bit of an intro, and then we'll get right into the material.
Sure. So I'm a board certified urologist, but I am now an expert in sexual and male rejuvenation.
Okay.
So men's sexual health. But I went to Brown University. I trained at Vanderbilt. I did a year of Howard Hughes Medical Institute sponsored research at Harvard Medical School. I trained as a surgeon at UCLA and then as a urologist. And then I went to private practice in Northern California, where I pioneered surgical robotics. I pioneered MRI-guided prostate biopsy. I built kidney stone centers. And I was the head of my urology group up until a couple of years ago. I was just voted the top urologist in the San Francisco Bay Area for the 9th year in a row. And about 3 years ago, I became really interested in regenerative urology. So the ability to help men who have lost the ability to get an erection to become potent once again. And so that sort of led me into doing clinical research, writing books, becoming a national speaker, YouTube channels, and all that kind of stuff. And The 21st Century Man was a book that really was devoted to my patients and what I've learned over those 25 years and all of the colleagues who gave me advice about their various fields, and wrapped up into 101 chapters and over 900 pages. And it's about prevention and early intervention for men.
Okay.
Because men's health really is a catastrophe in this country.
Absolutely. It is an absolute tragedy, I think, what's going on. So I guess my question is, at least to kick us off here, is when and where do men go wrong? Like when does it start going sideways? And sort of maybe big picture, what are the things that lead a man down the road where he's feeling like He-Man at 21, and then by the time he's 30 or 40, he just doesn't have it anymore?
Yeah. Well, it started to go bad for men about 100 years ago.
Whoa.
So men lived 1 year less than women about 100 years ago. And now men live 5 years less than women. So over 100 years, women got healthier and healthier, but men didn't keep up. In fact, if you look at Caucasian men, middle-aged men, they actually are living less long now than they were 15 years ago.
Wow.
And the reason for that is alcohol, opioids, and suicide, what we call diseases of despair. And this predates COVID. COVID's just going to accelerate that process.
Okay.
And men are half as likely to go to a primary care physician as women. 50% of men have high blood pressure, 40% of men are obese, 15% of men smoke, 12% of men don't even have health insurance. Okay, so it's primarily because we don't take care of ourselves. Okay, and so then the question is, okay, well, why don't we take care of ourselves? So there's this ethos that we're strong, we're tough, shake it off, it'll get better on its own.
Yeah.
And that works when you're 20 or 30, but at a certain point that begins to break down. You can smoke in your 20s and 30s. I was talking to a friend of mine who was saying that Vlade Divac, the basketball player, used to smoke at halftime, whatever, and he could get away with it, right? Because you're in your 20s, everything's working, your blood vessels are great, but those bad habits begin to compound themselves, and patients will come in to see me in their 40s or 50s or 60s, and they'll be overweight, they'll have lost muscle, they'll have erectile dysfunction, their testosterone's low, they'll be depressed. I mean, I've seen it all. And that's what happens, is that men have this this feeling like I'm strong, I can take care of myself. I don't need anyone else to take care of me. So we actually train other people not to take care of us.
Yeah.
That we're the caretaker and we don't need help.
Yeah. And is the alcohol and the opioids, is that like a compensation for not seeking help? Like, is that how they just sort of get by? Is doing that?
Yeah,
Or
I
is
think,
that,
it's like putting a Band-Aid. It's like forgetting about things,
yeah.
right? It's like, oh, I feel pain, let's take a pill, instead of let's figure out what the source of the pain is. Okay, I have back pain. Let me strengthen my core. Let me go see the chiropractor to get adjusted. Let me go stretch every morning. All these things that are prevention or early intervention. Or, I have a lower back congenital issue, and I live in fear of doing something that's going to mess up my back. And so every morning I wake up and I do 15, 20 minutes of stretching. I strengthen my abs. I strengthen my posterior chain, because I'm all about prevention. And the 21st century man is all about prevention and early intervention, because we're not like cars.
Yeah.
Right. You clog a carburetor or bust a spark plug in the car, you just replace it, or you can even replace the whole engine. But if you clog the arteries to your penis, guess what? Your sex life's over.
Mm.
If you clog the coronary arteries and you have a massive heart attack, a quarter of men don't even make it to the hospital.
Right.
And the 3/4 of men that do, cardiac rehab is no picnic.
Mm-mm.
So, it's really, really important for the men that are out there to understand that you got to take care of your own health. And that's not just physical health. It's mental health, it's emotional health, it's relationship health, it's sexual health. And 21st century man is written for you. It's written for men over the age of 35. Under 25, under 35, you can get away with stuff.
Yeah.
But over the age of 35, you really have to start being focused on understanding how to take care of yourself, because it's going to affect the quality of your life in the next decades.
Yeah, I find it fascinating. And I was very fortunate to have some good mentors early on, who taught me the both and principle. It's like, you can be that strong man, you can be that, tough guy, and you can still take care of yourself. You know what I mean? It's like, you don't have to give up being, a tough guy or a strong guy or a protector or some sort of, whatever identity you have, that you are, and sacrifice your health because of that. You literally can have both worlds, from there. So what are the big things that you notice that where men are going wrong? Is it a lack of exercise? Is it that they don't watch their diet? Is it just that they don't have somebody in their corner, as a physician or somebody coaching them along on what they need to do? Is it flat out stubbornness? What is it?
Can I check E, all of the above?
Yeah, you can. It probably is
It's like a test. All the above.
Yeah.
What I say in the beginning of the book is, like, the most important stuff is actually free. So eating right, don't eat too much, don't drink alcohol, or at least if you drink in moderation. Don't smoke, don't do drugs, exercise every day, do some stretching, do some meditation, get some basic medical care and some preventative care and some screening tests periodically, which most insurance companies cover for free. Like, if you do all that stuff, you got 95% of what you need to do. The problem is that there's a lot of pressures in life. Sometimes we need crutches. Sometimes we need, like, I have ice cream almost every night, right? It's stupid. My cholesterol's too high, but it's just what I need, like, that's kind of my own really only bad habit.
Yeah.
And, I know better, but I just do it. So I'm not, the book isn't about shaming people. It's not about judging people. It's providing world-class information from world-class physicians and men's health experts to men, intelligent men who are in charge of their own health and in charge of their own life. And one thing I've learned taking care of men is you can't tell a man what to do. If you tell a man what to do, he'll just look at you like, screw you, I'll do whatever the hell I want.
Yeah.
Right. What you have to do is provide information. And when you provide information, then men can make informed decisions. Like, for example, I had this one patient, he was a 57-year-old dentist, right? And, he was in reasonably good health, except he was a lifelong smoker, right? And he had an immigrant story and a really kind of tough life. And, I didn't judge him for smoking, and he knew not to smoke, and he knew the health consequences of smoking. He tried to stop smoking a couple of times. And, we were talking about his erectile dysfunction, which, clearly was partially because of smoking. I said, listen, I'm not going to talk to you about smoking. The only thing I want you to do is understand that people that smoke heavily will lose 13 years of their life expectancy. And I know you have 2 daughters. So what I want you to do is get a piece of paper and just write 13 years of life lost and put that on the doors of your 2 daughters' bedrooms, so that every time you walk into their rooms, you'll be reminded of how much of life you're going to lose with your 2 daughters. And he just kind of looked at me and I said, yeah, just do it, And a month later, he came back, he said, you know what, I stopped smoking.
Yeah.
Right. So if I had told him, listen, stop smoking, you idiot, it's bad for you, he would have been like, screw you, I'll do whatever the hell I want.
Yeah. And how many times have he already heard that? What I mean? From other physicians, and
but to be reminded of the consequences of his decisions.
Yeah.
For example, alcohol. I talked to a lot of guys about alcohol. I stopped drinking alcohol about 10 years ago when my kids were heading towards teenage years. My wife and I just sat down and we said, we have a glass of wine every night, sometimes 2, but rarely 2. But we don't want alcohol around the house. And I asked my kids, where do kids get alcohol? And they say, oh, it's usually from, because when I grew up, you could get a fake ID and it was easy, and you just go to the dairy barn and pick up a 6-pack of beer and no problem. But these days, it's a little more difficult to get a fake ID. And so kids get alcohol from their parents' house.
Oh, yeah.
And so my wife and I decided, listen, we don't want to have alcohol in our house so that our kids are tempted to drink. Right. And so that was when I was 45 years old. And from a health perspective, it was one of the best decisions that I made in my life, because alcohol is 3 things. First of all, alcohol is a depressant, right? If you look up alcohol and the class of drug it's in, it's a depressant. What do depressants do? They decrease your mood. They make you sad, okay? Second of all, alcohol disinhibits you, right? That's why it's fun when you're in a good mood, because you'll do kind of crazy, funny, wild stuff. But I would venture to guess that most of the stupid decisions that a lot of us make in our life are done under the influence of alcohol.
Yeah.
In fact, I was talking to a patient just the other day about this, and he started to tear up. And I kind of looked at him, and he pointed to the side of his face, and he was African-American, so I couldn't really tell. But then I looked closely, and he had this massive scar along the side of his face. And he goes, yeah, that was under the influence of alcohol. But domestic abuse, car accidents, stupid financial decisions, relationship decisions done under the influence of alcohol, it almost always turns out bad.
Yeah.
And then third of all, in a country where 40% of men are obese, alcohol is empty calories, right? So you can take a bottle of vodka and put a match on it and it'll burn, right? So a calorie is a unit of energy.
Yep.
Alcohol is energy intense, but it has no nutritional value. No vitamins, no minerals, no protein, none of the good stuff. I'm actually expecting one of these vodka companies to have like a vitamin infused vodka or something like that.
That sounds like
while you're drinking
business
your vodka. Yeah, exactly. Out there, for all of you Shark Tank entrepreneurs out there, come out with a healthy vodka.
Right. There you go. Add some amino acids to it. And we're
exactly.
in business. We're in business. So you mentioned earlier, basic screening tests for men. One, what are those? And two, when should they start getting them?
Yeah. So as a urologist, there are two things that you definitely need to do. One is to examine your testicles every month to make sure that you don't have any new lumps or bumps in the testicle, which could indicate testicular cancer. The other is checking a PSA, and there is controversy about PSA and about prostate cancer. But as a urologist, there's nothing sadder to me than diagnosing a man with prostate cancer that is clearly an easily preventable and easily treatable disease. And PSA is just a blood test. I got mine first when I was 40 years old, then I got one when I was 45, then I got one when I was 50, and then probably every 2 years after that, till you're about 70, 75 years old. And most prostate cancers will cause a rise in PSA. There's an amazing chapter in the book on prostate cancer that I wrote that explains about enlarged prostate and about prostate cancer. We have a lot of new diagnostic tools for prostate cancer, including genetic testing, including MRIs, so that we won't be overdiagnosing and over-treating prostate cancer like we did before. So the important thing is to catch prostate cancer early, but then if you do diagnose and treat it, make sure that you don't overtreat it. There are clearly some people that need aggressive treatment, and there are clearly some people that need just monitoring.
Okay.
So PSA, testicular self-examination, checking your urine every year, every 2 years for blood. A urine analysis is like a $3 test that gives you amazing information. Okay. It can pick up diabetes, it can pick up blood in the urine, which could be kidney stones, could be bladder cancer, could be kidney cancer, a colonoscopy. I get so sad. Every year I hear of like some famous person or some friend of a friend that is dying of colon cancer. A friend of my wife's husband recently passed away at the age of 52 of colon cancer. Colonoscopy is no fun, right? But dying of colon cancer, with a colostomy bag, with shit coming into the colostomy bag, that's no fun either.
No.
And so it's worth every 10 years. The colonoscopy part, I did mine a couple of years ago. It's not a big deal. The prep is the miserable part, when spending a day and a half on the toilet is no fun. But, chemotherapy, having a piece of your colon removed, colostomy bag, that's a heck of a way to go.
Absolutely. Yeah. It's like I always say, it's like there's two pains in life, the pain of discipline and the pain of regret,
Yeah.
And the one of them hurts a whole heck of a lot more than the other one does. Yeah. That is for sure. Let me ask you this. When we look at, because you mentioned suicide, obviously that's been big time in the press. And you probably touch on this in your book because it was like that top 3: alcohol, opioids, and suicide. What are maybe some indicators that men should be looking out for? What are some things that maybe kind of push them in that direction? What do they need to really watch out for?
Yeah, those are really great questions, and that honestly, that's not in my expertise, which is why I brought in psychologists. So there's an amazing chapter on depression. There's an amazing chapter on anxiety written by Brett McLaughlin, who's the dean of a psychology school. There's amazing chapters on work-life balance. Okay. So that's something I suffer from, and almost every man who has a profession and a family in fact, Robert Bonfiglio, he's the head of the California Psychological Association, wrote this amazing chapter on work-life balance. And it's such an important thing for me. I have a narrative that kind of runs through the book. So there are 14 sections, and I wrote introductions to each of the sections. And then chapters that were really important to me, I wanted to weigh in on, like I wrote a couple pages in the fatherhood chapter. I wrote a couple pages in the work-life balance chapter, and I talk about not work-life balance, but work-life pendulum, right? So for me, the idea of like a work-life balance is really kind of, it just doesn't exist for me. You know, maybe you have perfect balance,
No.
but for me, it's a pendulum, right? Either I'm working too much and my wife reminds me I'm working too much, sometimes, you know, in more harsh terms than that. And then it swings over towards, you know, spending a lot of time with the wife and the family and the kids. And then, you know, you see the income go down, and then, so then you swing back towards working more. And as long as the swings aren't too extreme, you know, so that you can't pay the mortgage because you're spending too much time at home,
Yeah.
or, you know, you're getting divorced because you're not spending any time, you know, with the wife. That to me is the best way to see it. And, you know, I think that one of the important things in reading the book for men is to understand that we all suffer from this, right? Like, I'm not putting myself out there as like the paragon of men, right? What I'm saying is there are 101 chapters. There's like at least 101 problems that we all have. And I'm just trying I've been blessed to train at some of the world's best medical institutions under the world's best professors. And I'm just trying to give you a piece of what I've learned from those people and from the network of really outstanding physicians that I'm blessed to work with, to all the men out there who purchased the book. And, you know, the book's available in hardcover. It's available in ebook, because I have a lot of patients that fly, you know, for work, and they're like, I don't want to take a 5-pound book on the plane with me. And then I have an audio book because we have long commutes in Northern California. And so some people are like, well, you know, I like to listen to books on the way to work.
No, great idea. Great idea. Yeah. And I think that's just, again, I don't think it could be any more timely because of the decline of men over time. And I think, you know, one of the things that I wanted to touch on as well, and you mentioned it earlier, was the whole ED situation, you know, erectile dysfunction, you know, and then you're losing blood flow, you know, to it, and things like that. And this is not necessarily, this is not like a pat on the back or anything, but I'm 47, you know, and I'm just like, wow, I'm like, I feel like it works just as good as it did when I was in my early 20s. You know, I'm like, I feel like I'm in my prime. So but I know that's not every man's story either. But I've been, you know, living the natural healthcare life and taking care of myself, you know, since I was in my teens. So it's a little bit different. And I've had all my own ups and downs and health challenges and all those kinds of things to overcome as well. But like, where does that go wrong? Like, what are the maybe the main things that create that situation? Because it seems to be like, you know, a massive problem.
Yeah. So there was something called the Massachusetts Male Aging Study. It was done maybe 15, 20 years ago. And they looked at the incidence of erectile dysfunction in men in the United States. And so men in their 40s, 40% of men in their 40s complained of some degree of erectile dysfunction. 50% of men in their 50s, 60% of men in their 60s, 70% of men in their 70s. These are, you know, these are round numbers, but 50% of men over the age of 50 have some degree of erectile dysfunction, right? And it's a function of circulation, right? So 85, 90% of erectile dysfunction relates to circulation. You know, some of it's neurogenic, meaning related to nerves. So if you have prostate surgery, or if you have multiple sclerosis or strokes or those kind of things. And some of it is what we call psychogenic, which is, you know, anxiety or those kind of things. But, you know, 85, 90% of it is circulation. Okay. And what are the things that can affect circulation? So diet, you know, numero uno, what you put in your body. You know, I have a great example. My house is about 40 years old. My kitchen sink got clogged. I'm one of those do-it-yourselfers, so I had snakes and all sorts of stuff down the pipes trying to fix it myself, but I finally couldn't. So I called a plumber. He came out, cut the pipe with a Sawzall, and the pipe had this like amazing layer of like grease that accumulated over 40 years, because we're pretty careful about what we put down the sink. But over 40 years, it accumulated this big wad of grease, and it was about 75% clogged. And I was just looking at it going, you know, that's what happens to arteries. That's a 70% clogged artery. But with erections, right, the blood vessels to the penis, the internal pudendal and the deep cavernosal artery are 1 to 2 millimeters. The arteries to the heart are 3 to 4 millimeters.
Wow.
But the cross-sectional area of the arteries to the penis are about a quarter of what they are to the heart. So guess what's going to get clogged first? Arteries to the penis, right?
Yeah.
So, you know, if you get anything out of this podcast, if you have erectile dysfunction and you don't do anything about it, in 10 years, you're probably going to have a heart attack. Okay, because it takes about 10 years for the clogging to get to a 3 to 4 millimeter blood vessel, right? That's just data. That's looking at hundreds of thousands of men when they develop erectile dysfunction, when they develop cardiovascular disease, you know, heart attack, stent, angioplasty, stroke, you know, some sort of cardiac event.
Yeah.
Due to circulation. So, you know, the good Lord is giving you an early warning signal. You know, your penis is telling you, wake the hell up.
Yeah.
Okay, do something about it. What can you do about it? Eat better, right? Obesity, you know, 40% of men are obese. Okay, so first of all, it makes, you know, it clogs your arteries. Second of all, it's much harder to exercise when you're obese, right? So you're much more likely to sit on the couch. What happens when you sit on the couch? Your body is smart. Your body is saying, listen, I'm pretty sedentary. I don't need to make that much testosterone, right? If you look at hunters and farmers, not to insult farmers, but hunters, you know, not like shoot a gun at a half a mile away to kill a deer, but, you know, hunters out on the plains that are riding a horse and taking down a wild buffalo need high levels of testosterone. You can't do something like that unless you're amped up on testosterone. Yep. But if you're dropping seeds in the ground and growing corn, you don't need super high levels of testosterone. And if you're, you know, punching the clock at work and sitting on the couch and watching TV or playing video games, you definitely don't need testosterone. So your body's not going to waste any energy making testosterone. And so you get fat. And then guess what happens in fat? Fat aromatizes testosterone. What does that mean? It turns testosterone into estrogen, right? So we're taught men are from Mars and women are from Venus, and that may be true. But if you look chemically at a testosterone molecule and an estrogen molecule, they're virtually exactly the same, except for one hydrogen atom, right? One neutron, one proton, one electron, the smallest unit of matter separates the male hormone from the female hormone. So in fat, you get aromatization of testosterone, turns into estrogen. And then guess what? You get man boobs, you know, you get emotional, you start buying Barbra Streisand albums, you go see Bette Midler movies.
Good Lord, don't do that.
Yeah, I mean, it's a slippery, slippery slope. So, you know, first of all, you got to eat right. Second of all, smoking is about the stupidest thing a human being could do. You know, you're going to lose 13 years of your life. You're going to get bladder cancer. You're going to get kidney cancer. You're going to get lung cancer. You're going to get erectile dysfunction. You'll get away with it through 35, 40, but it's going to catch up with you. And, you know, it's never too late. The data shows it's never too late to stop smoking. Drinking is different. It's really interesting. You know, once you get your liver to the point where it's cirrhotic, you know, it's too late. But with smoking, if you stop smoking, your health and statistically, your health numbers will start to improve.
Wow. Wow. You mentioned sort of the low testosterone. Now, do you also deal with that as well in your practice?
Absolutely. It's essential.
And obviously, the body will downregulate the necessity of it if a person isn't moving around. So, are there any lifestyle factors that you encourage men to do outside of, say, creams and injections and all these other kinds of things? Now, granted, they need to go out there and exercise, but It's my understanding certain exercises are much more efficacious when it comes to getting the body to actually produce testosterone. Are there certain ones where you say, hey, you need to go in and do X?
Yeah, that's a great question. And to be honest, I don't know that I know the answer, and I don't know that anyone really knows the answer. I don't think anyone's ever a study of like swimmers versus runners versus football players or whatever.
Yeah.
Clearly if you're going to be in like a amped up combat situation, your body's going to, I would expect a boxer to have a higher testosterone level than a long distance runner.
Yeah.
But to me, it's kind of like a little bit of, it's a great question and it's a great research question. Don't get me wrong, but it's a little bit of splitting hairs. Like I had a patient that come in the other day and he's like, I heard that buffalo protein is better than beef. I'm like, dude, I don't know. Just eat 100 grams of protein a day as the beginning staple of your diet.
Yeah.
Work around that. And then I have a male rejuvenation protocol that is just astonishing. It's in the book.
Okay.
And I just submitted for publication a series of my patients who are in their 60s, men between the ages of 61 and 69, who over a period of 4 months put on 5 to 10 pounds of muscle and took off 10 to 20 pounds of fat, right? And it's by boosting testosterone, because testosterone's a growth factor, right?
Yeah. Testosterone's
a lot of things, but in the end, it's really a growth factor. That's the important thing to understand. So my son is 15 and a half now. I think he'd be embarrassed if I keep talking to him about him on these podcasts. So I hope he doesn't listen to my podcast. But a couple of years ago, his testosterone was probably 200 or 300, right? He was pre-puberty, right? That's when you're 12 years old, that's what your testosterone is.
Right.
Right. Then now he's 15 and a half. He's, I'm sure his testosterone is 900 or 1,000. And he's, the star of his cross-country team, et cetera, et cetera, et cetera. Right. And he's like running faster every year, every workout. He's putting muscle on. That's what testosterone does, right? Builds muscle, gets rid of fat, makes you focus more, gives you intensity, gives you libido, gives you athletic performance, right? And so as you get older, your testosterone peaks when you're 20. Every year after that, it drops 1 or 2%. It's not like women. Women go through menopause. So their estrogen is high and then boom, it's gone.
Yeah.
Right. And there's an amazing chapter in the book called What Guys Need to Know About Menopause, right? If you're in your 50s and your wife's in their 50s, you have to read that chapter. Menopause can ruin your relationship if you don't understand it. And this is written by a male gynecologist, Russ Bartels. He wrote the most amazing chapter on menopause you've ever read, right? After that, you'll understand menopause and the aging vagina. And if you don't get it, if you don't understand it in your 50s and 60s, your sex life will be over. It just will.
Yeah.
But if you understand it and you're empathetic to your wife and you talk to her about hormone replacement and vaginal dryness and all that kind of stuff, you could, I have patients in their 50s and 60s and even 70s that are, I had this one guy, he's 77. He just came back from a week in hedonism. Yeah. It's badass. 10 years ago, he came to me because he couldn't get an erection.
Whoa.
Right. 3 years ago, I started doing shockwave therapy on him and PRP. And I have a supplement called Affirm, which you can get at Affirm Science, which is a circulation boosting supplement, totally healthy. Yeah. I got him on PD5 inhibitor, tadalafil every day. And 77, he's like, I was the star of hedonism. Seriously, it's like, but he's like the happiest guy in the room.
Yeah, no, I get that. And I remember this. I never was a huge Dr. Oz show fan or anything.
I thought you were going to say you were never a hedonism fan.
Well, probably wasn't a fan of that. Well, maybe just me and my wife only.
Okay.
But anyway, but I remember on one show that I just happened to hear in the background, they were talking about men's health, and they were saying that it's like the male penis. It should work up until you're like in your 120 or something like that. It's like the measuring stick of a man's health, from there, which is basically everything we've been talking about, from there. And I think that, like you said earlier, it's a warning sign when you can't get an erection that within 10 years you're going to have a heart attack, or dang close, and that's probably an average. For some guys it might be a year, other ones it might take a little bit longer. But I think one of the biggest issues that I've always had with healthcare in general is it seems to be compartmentalized, and it's just like there is no compartmentalization. Like it all works together. You know what I mean? It's like if your cardiovascular health is going down, chances are you have many other systems that are also breaking down, as well. And your health is just going to go south a lot faster than you think it's gonna. Because we've all seen those folks that are like, Doc, up until like last week, I was fine, and you do your analysis and you're just like, okay, well, you got 37 things going on. That didn't all happen in the last week,
Jason, you're right on the money. And there's a chapter that I wrote in the book, which is how to go to your doctor visit. Okay. It's a really, that's another, like, this is just an incredible nugget in the book. Just like if you just bought the book for this chapter alone, it would be worth the money. Okay. Because the thing is, it used to be 50 years ago, doctors lived on the top of a tall mountain and they controlled all the information, and they would dole it out, and people would, hinge on every word that the doctor said. But that's not the case anymore. When I did research at Harvard Medical School had the top medical library in the world. They had 1 million volumes in the library. People would come around the world, pay a lot of money to do research in the Harvard Medical School library. Now you hold that in the palm of your hand in an iPhone. You don't need to go to Harvard Medical School library. You need just to go look stuff up. So people look stuff up, right? Yep. But you have to be a partner with your physician in taking care of yourself. And what do I mean by that? Cerner did a study. They looked at 100 million charts, right? That's a good statistical sample, 100 million charts. And what they found is the average time you spend in a doctor's office is 16 minutes and 14 seconds. Not in the waiting room, but the time you actually like get put in a room, right? You got to make the most of that 16 minutes and 14 seconds. So when the doctor comes in, if you're talking about your pet cat and the 49ers and the weather, you just wasted a lot of time, right? What you have to do is write down your health history on a piece of paper, just put it in the computer so you can keep updating it, print it out for the doctor, a list of medications, a list of labs, a list of your recent imaging studies, a description of why you're there. My back pain started 3 weeks ago. It started on the left side. Now it's on the right side. It radiates down my leg. It started at pain level 10. Now it's at pain level 5. I'm taking Motrin and Tylenol for it. I had pain like this 3 years ago, and I had an epidural, and I had an MRI, and et cetera, et cetera, et cetera, right? And then write down a list of questions. What are the questions you want that doctor to answer for you? And if you hand that to the doctor at the beginning of your visit, I almost guarantee that you're going to walk out of there, one, with a better relationship with your doctor, but second of all, you're going to walk out of there with the answers to the questions that you came in there with and a much more accurate diagnosis. So it's really important. And this is coming from a doctor who's been seeing patients for 25 years, that was voted the top urologist in the San Francisco Bay Area 9 years in a row. This is how I train my patients to work with me, so that I get the most. I have on my YouTube channel, I have the men's sexual health curriculum. I tell my patients, watch the men's sexual health curriculum. This is all the basic stuff that I'm going to tell you, so that you can come in with second, third, and fourth tier questions, how they relate to you. I want you to make the most of your time with me. And that's how you should plan your visit to the doctor.
Yeah, I like that. And I also think the physicians who are listening to this as well, can from just those few things right there, can tighten up their intake process. You know what I mean? Because I think a lot of time, as you said, is wasted. through having to do all of these things. And most all of that stuff, you can automate it. Just like, hey,
Absolutely.
just fill these things out and bring them with you, when you come in, type of thing. And if they don't have them ready when they come in, you can just sit over here and fill them out. And then when you are ready, then we'll see you, type of a thing.
I mean, I have a Dragon voice dictation system. I just leaf through stuff. I mean, as a doctor, there's stuff that's relevant. There's stuff that's not relevant. If you had your tonsils out when you were 6, I don't care. So, I just dictate all the stuff that's relevant to me. And then I hand it to my people, they scan it, and then boom, let's go. Let's focus on you. What, why are you here? How can I help you? What are your expectations? What are your goals? And let's see what we can do to get you there.
Yeah. And I think that's really the thing. It's just because that's what the patient, is looking for when they come in there. They're like, what's in this appointment for me? And I have goals and dreams and outcomes that I'm looking for. Can you help me achieve it? And the sooner we know what those things are, the sooner we can get our tests done, and the sooner we can determine, hey, here's what we need to do. We just need to execute, and do this. And here, and by the way, Mr. Patient, here is your half of the equation. I'm going to do my half over here, and then you're going to do your half, when you go home.
Oh, absolutely. I tell my patients, listen, I can give you a world-class plan. There's hardly anyone in the that is in men's health that can give a patient a plan like I can.
Mm-hmm.
Right. I mean, I've honed this over 25 years. But then I look the patient in the eye and say, listen, I'm not going to go home. I'm not your mother. I won't henpeck you to do this stuff. I got my own problems to deal with.
Yep.
This is the plan. You need to have the determination to execute on this plan.
Yep.
And you can come in periodically and we'll do diagnostics and we'll do, we'll get data on you and figure out where you are in this plan. And if you want, a pat on the back or a little inspirational speech, I can give that to you, but it's up to you. And there's a couple of overriding themes that go through the 21st century man. And that first chapter is called The Hero's Journey. And the idea is that we're all the heroes of our own life's journey. Stop looking outward at Tiger Woods or Tom Brady or Bruce Springsteen or Barack Obama or whoever for your hero. Like, they have their own problems. Believe me. I mean, every week it seems like another celebrity is just falling down, Prince Andrew or Epstein or whatever, everyone's got problems. Let's just, in the 101 chapters in the book, every man has 10 or 20 chapters that apply to them. So just focus on being the hero of your own journey. And so when it comes time to, should I have another beer or not? Or should I, have another steak or not? Or should I smoke another cigarette or not? Or should I get my lazy ass up off the couch and go for that workout? What decision would a hero make? And then you'll know the right choice for you. Yeah. If you want to be the hero to your family, if you want to be the hero to your workplace, if you want to be the hero to your community, the right decisions. It's just having the determination to make the right decision.
Absolutely. Absolutely. Yeah. And it just kind of goes along with, what we say over and over again in our office, which is, your health is your responsibility. But it's also your duty and your obligation to do it. And without, like you said, you can have the best plan in the world, but, a great plan that's not executed isn't any good, and you can have a poorer plan and they execute on it is better than that plan.
I'm just remembering that one of my favorite Mike Tyson quotes, everyone has a plan until they get hit in the face.
That's right.
I mean, life hits you in the face. It hits you in the face a lot. I've been, I started my own hero's journey about 3 years ago by getting hit in the face by my ex-partners, a lot of them who I hired. They wanted to sell themselves to the hospital and become hospital employees. I didn't want to.
Good for you.
And so they rewarded me by firing me. And so then I rewarded them with 2 large lawsuits, which fortunately I won. But, that was a punch in the face. I had plans for, building other interesting sources of income and programs within our practice. And I got punched in the face. So, but it's how you react in that situation.
I think so. And I think anytime you start undertaking something important, and I can't think of anything more important than getting your health back, well, maybe keeping it. I think that's more important. You're going to face challenges. I mean, God, the universe, whatever you think is gonna, as soon as you start something new, you can just guarantee that challenges are going to come. And some of them are going to be really freaking hard, and it's just like having that, sort of center point, like you said, like 13 years on your daughter's door, because I think that's fairly typical of men, is men will do it for somebody else when they won't do it for themselves. And whatever that, I hate to use the word motivation because I'm not really big on motivation, but whatever gets them to do whatever it is they need to do to be that healthy person and be that better dad and father and, husband or whatever that it is, they just need to get after it, and find that focus point and just go.
Absolutely.
Yeah.
I couldn't
Doc,
agree with you more.
this has been great, man. Really, really great. Not only inspiring, in terms of, the fact that we finally get a chance to focus on men's health, but the multiple areas that we actually got to go through that are so incredibly important to men. And certainly in my own life, being 47, so it's like now is the time for me to even double down on good decisions for myself. But just the fact that, we have someone out there like you who is putting out incredible content, writing an incredible book, sharing it with the world, and having that information available for men to just read it, make their own decision. Like I always say in our office, hey, if you want to destroy your own health, you're welcome to do that. You're an American, hey, have at it, but if you want to be the healthiest version of yourself, guess what? You get to do that too. So it's just a decision, and you can't have one or the other. I mean, you can't have both, but you can pick one of them and go with it. So I just thank you for not only coming on and doing the interview, but also just for, for who you are and what you're doing for, just, men in general. But I also know that, just sort of as a collective, just helping society just be a healthier person, because as men are healthier, I think the society is healthier, as well.
Oh yeah, we need the help.
And we do. We absolutely do. So thank you again for coming on, and
hey, my
we'll have to
pleasure.
do this again.
Yeah, and honestly, we barely scratched the surface of the information in the book. And I just want to say, I either wrote or edited every chapter in the book. And I can just tell you, like, the one thing that really annoys me is I'll read like a 200-page book and I'll be like, that could have been summarized in 5 pages.
Right.
Just give me the 5 pages. I don't need to read the rest of the crap. But I'll look you in the eye. I'm big on looking people in the eye, right?
Yeah.
I'll look you in the eye and tell you that every word in this book is relevant, and everything is a Cliff Notes version of what you need to know, written by, a national or world expert, and written in a language that relates to guys in a way that won't shame you, that won't judge you, that will provide you with the information, like as if the author was, your next door neighbor who just happened to be the best cardiologist in the country, or happened to be the head of oncology. Ethan Bash is the head of oncology, University of North Carolina, is one of my best friends. And he wrote the chapter on how to avoid cancer. Right.
Awesome.
And in a language that guys relate to. And I promise you, I won't waste your time. And you don't have to read all 900 pages. Just read the introduction, read the first chapter, and then pick and choose what relates to you at this moment. And then if you don't have a prostate problem, don't read the prostate chapter. But in 2 or 3 years, if you develop a prostate problem, go back to the book.
Yeah. Because
that information is so cutting edge right now, it'll still be relevant 2 or 3 years from now.
Yeah. Awesome. Well, you guys heard it here first. It's like, use it as a reference guide. It's like, just do the things that are most important to you for right now, but just know that the other stuff is actually in there. So again, Dr. Judson, thank you so much for being here. And then, like I said, look forward to doing it again sometime soon.
You got it, my friend.
All right.
Okay.